Thank you. All right, I will start. So today, the presentation, we're all about finding ways to kill dementia. And I was so impressed by a lot of research with the really hardworking research groups finding some interesting ways, interesting methods. With different data to find the golden factors to detect early signs of dementia. I must say I'm not coming from a medical background. I come from engineering background, but for the past few years I've been working with my lab at School of School of Psychological Science to learn about the psychology of the brain, the cognition, memory, and as a result, dementia and Alzheimer's. I deal with the data. I deal with the different features, the factors I get with intelligent modeling. I mean, supervised and supervised machine learning model as well as deep learning model. For the sake of this presentation, I'm going to present briefly a recent publication that has been developed by our team. This is based on explore the role of psychological science or psychological tests, the early detection of dementia, and also the importance of intelligent modeling in detecting the cognitive decline. So the aim that always I've been thinking of, based on my studies, based on my training with the brain and with the neurodegenerative disorders, were based on a question for everybody, because all of us at a risk. We don't know we don't know when we gonna get the cognitive decline, regardless the inherited genes. This is, for example, this individual is wondering whether he or she might have memory decline in the future, possibly dementia condition or Alzheimer's disease. And there's a problem. The problem is we need to detect the early signs before the mild symptoms appear. And earlier in this talk, one of the colleagues, or earlier in this conference, one of the colleagues mentioned there is two types of detection. We have the timely detection and early detection, and that was really interesting to mention. For the sake of this research, I was always thinking of having the early detection because it gives you some time space, so you can further improve the treatment or try to or stop the disease from deterioration. Now, this is the problem, and there's some solution which could be the genetic test, biomarkers, brain image, PET scans. All of these has been done at early ages. We can somehow find some dysfunctioning in the brain, changing the size of the brain measures, or kind of changing the numbers of the biomarkers test. However, there's another problem, which is that such tests is expensive and require huge time and efforts. And that's why it made us to think about some easy, accessible solution, which be helpful for individuals and for people, doctor, neurologists, work especially with NHS. This comes from just mainly depend on the psychological tests. The psychological test that's been used by memory clinic after the diagnosis of dementia. So why don't we use psychological tests before the diagnosis of dementia? There are a lot of psychological tests, but which one? For this research, I found out the psychological tests that are related to the storytelling or person ability to recall information after a prescribed amount of time could be very effective towards some very early warning signs about cognitive decline or memory decline. And the way of defining such hidden features inside such psychological tests could be revealed, or could be shown by using the power of AI, which can easily detect the performance and flag up any early deterioration. When I say AI, it's artificial intelligence, mainly the supervised machine learning model, unsupervised machine learning model, or even sometimes with the deep learning models. So this is the paper I've been we worked with. I worked with my team up to analyze its data, and the marks, which I call it the markers, or marks, X marks the spot, and for me it has a lot of X's here. It's I mainly targeted some factors that everybody can agree on. These factors could be genetic risks, including family history, ApoE, ethnicity, the race, the heart disease, inflammation, depression, hormonal respiratory disease if available, also risk related to environment and lifestyle. And here you can see this is a very interesting book called The XX Brain. This book has been written by Dr. Lisa Mosconi. She's a neurologist in America, and she devised a healthy way of helping individuals, especially female, to overcome the cognitive decline in the future. And she mentioned that she is like this quote from her book that memory loss doesn't happen according to a date and a time on a calendar. It's greatly associated with several factors in our lives. So basically, she found out that the environment and lifestyle could really affect our cognition, even for those who already carries the ApoE gene and inherited the gene of Alzheimer from their ancestors or from their family. They can still survive without any cognitive decline through developing some healthy lifestyles. So the aim of my study is to investigate some factors associated with Alzheimer and dementia, and I got these data. I didn't recruit people because my funding wasn't enough, but I seek some trusted secondary data analysis pools. I will explain them later, to get that data and analyze their measures using the supervised machine learning predictors, and find the possibility or find the factors that could be targeted by memory clinic, by practitioners, by neurologists, for each individual to examine before the mild symptoms appear. When I say mild symptoms appear, means all of you know that before the memory loss happen. And the purpose of this analysis, where we used two types of measurements. So I used the baseline measurements, and I used the longitudinal data, or like multiple time scales measurements. So basically, I got same patients who gone through the baseline routine or baseline diagnosis, and is being given the diagnosis based on some scores by the neurologist, and also what the same idea of that patient went through the 4 years routine, where he or she had the observation of a couple of years every 6 months over 4 years period of time. The diagnosis differed. So with the baseline, the diagnosis had to be cognitively normal, mild cognitive impairment, early mild cognitive impairment, significant mild cognitive impairment, late mild cognitive impairment. So 5 diagnoses or 5 types of dementia. Whereas with the longitudinal data with 4 years, there are only 3 diagnoses. There were like cognitively normal, mild cognitive impairment, and Alzheimer's. And I managed to get the factors associated with them, which I will explain in the next slides, and did the analysis with 4 machine learning models. So here are the data. The data has been extracted from a data pool called ADNI. ADNI stands for Alzheimer's Disease Neuroimaging Initiative. It's available everywhere. It's got huge data sets. It's you get what you want from MRI, from the biomarkers, PET scans, demographic data, psychological tests. For the sake of this study, I have used a data set called AdeniMerge, that it has both longitudinal and cross-sectional measures or observation in one file. So it consists of 115 parameters. Parameters mean like measures or like variables, and 15,722 observation or participants. And mainly I use for this one, I chose to use a different type of demographic, like varies from age, gender, race, ethnicity, educational level, as well as a good bunch of psychological tests. And these psychological tests related to cognition, cognitive function, and changes in memory, attention, languages, executive function. This is some kind of descriptive analysis of the demographics I have used. So for this one, this side is for cross-sectional observation, and this is how many population coming with mild cognitive impairment, and this is the percentage of population of Alzheimer's and cognitively normal. So the majority, which is 15,000 observation or 15,000 participants, come with mild cognitive impairment. And here for the longitudinal data, where I had to measure, or the participant had to measure his or her ability, cognitive ability over 4 years. It comes with the I have the mild cognitive impairment and dementia and cognitively decline. Again, cognitively normal. Again, the mild cognitive impairment had the highest range. The distribution between male and female were average, so that was good for our data, is balanced, as well as the age here, the age between 70 or end of like 65 till 80. That's the age range. And these are the selected parameters. Again, with the language of intelligent modeling, it's the features, or like with the statistical modeling, what we call it is the variables, the dependent variables that we have. We had the demographic, as I mentioned before, the age, the gender, ethnicity, and the biogenetic markers, which includes the ApoE4, whether available or not, the FDG PET scans, the hippocampus size as well, and the full brain size, the whole brain size. And then I added the cognitive psychological test, because I believe there must be a power behind such cognitive or such psychological tests, could show something even at early ages. So we have these different type of, we have ADAS-11, we have the RAV, we have the clinical dementia rate, MMSE, the RAV, the LIDL, and all of these, the FAC, which is functional activities questionnaire. All of these seek some type of memory, like episodic memory, or like spatial memory, to cognitive memory, just to find out any deterioration in such in the person or individual's behavior. I trained that data with the machine learning model. I trained the machine learning model with such data, and I've used, I'll just go briefly on this slide. I know it is very technical. I used for intelligent machine learning model, these are supervised machine learning model, where we define the independent variables and dependent variables together with what you call supervised, and gives a prediction over a huge data dimensionality. size. So I've used decision tree, where you said it's ensemble machine learning model. Again, random forest, which is multiple decision tree. Gradient booster, again, it is multiple random forest, similar to random forest ensemble. And also I've used logistic regression. This is not a statistical model, it's a classifier. So all of these based on classifier to classify precisely and accurately whether this person will be a cognitive normal, mild cognitive impairment, or Alzheimer's, based on the data I have in the future. So this what I did before dwelling into the data details, I split my data. In addition to split the data between the cross-sectional and multi-time scales data, I split the data into the independent variables. I split them into two groups: the biogenetics and the psychological tests. And the biogenetic, that includes the brain measures, the hippocampus measures, the blood tests, the ApoE4 genes, the PET scans, MRI scan, all of these in one side, in addition to the demographic, and the other data sets with all the psychological tests on the other side. So I just wanted to show whether any association between the biomarkers and the psychological tests, because I know from my knowledge, which is still growing through my learning about the brain and my research, interacting with the researcher neurologist, also my leader, Professor Michael Thomas. We all we can't go wrong with genes, but genes is very difficult to to be tested, especially for typical population. So with the biogenetic markers based on longitudinal measures and the cross-sectional measures, I trained 4 machine learning models on that data set. And the machine learning worked really well. However, I found out logistic regression classifier worked the best in terms of accuracy, in terms of precision, recall, F-score, all of these measures. It's something related to false positive, the distribution of false positive and false negatives in the data, and type 1 error, type 2 errors as well. So it depends on the accuracy we've got here. We can decide which model is good for detection. However, the rest really worked well as well. And for longitudinal measure, again, I found logistic regression had the best accuracy on that data in terms of data prediction. Again, logistic regression is a classifier; it's not a statistical model. And the interesting thing, what I found when I tried to find the feature importance, which is a technique that associated with a machine learning model to find what the features that I have used to train my 4 models, I found that the tau protein and amyloid beta, as well as the hippocampus, FDG, all of these biomarkers got very effective measures to predict the early detection or early status of the person cognition. And this is for the baseline data, similarly with the longitudinal data. And for the other set, which is just for cognitive and psychological tests, I have again implemented the data set with the cross-sectional and longitudinal data. And with this one, again, the logistic regression wins as a very good predictor for such data, but the rest, they did very well as well. We found out with the psychological test, we found that there is a test called LDLT total, wins, has the best prediction in terms of detecting the early signs of memory decline. And if I go back and define it here, sorry, here. So this test is to assess the individual ability to recall specific details about a story they have been told after a delay. So this is the association, what we found in the just take this away. Yeah, we can conclude that the episodic memory has a high impact on the early signs of cognitive decline, because that psychological test, detect the episodic memory, and it's really essential to find out such part of the brain that associated with the early signs of cognitive decline. I've done some research regarding spatial navigation skills, which really aligns with the research that's been introduced earlier in this conference that shows the importance of episodic memory. Again, this research confirms what it has been done, because that test, psychological test, detect that area in the brain, and shows a really high importance for the detection. And because the memory recall is associated with the frontal lobe, this could greatly help clinician in effectively detecting dementia type as a temporal lobe and hippocampus dominant memories, that hippocampus dominant memories and appetite, and that could explain some patients can, or some people with very early signs of dementia could experience some depression, anxiety, confusion due to that part of the brain. Furthermore, although some research from the genetic scores that highlight that APOE gene is important to detect whether this person will have Alzheimer in the future or not, this research didn't show any link, or shows a very small link between the detection or the association of APOE4 and the status of cognitive decline. So APOE4, it is just a risk, and it is not necessarily affect the cognitive decline in the future, or make the individual suffer from dementia in the future. And I hope I briefly covered my research. Let me know if you got any question. Thank you very much, and thank you for my funder, the BUCPIC, School of Psychological Science, Medical Research Council, as well as the Finney Jackson Trust that help returners, especially female, looking after their kids like me, to academia after a career break. Thank you very much all.